Good morning, everyone. I'm just checking with my coworkers. Do I sound loud and clear? Just want a quick clarification. Excellent.
I can
Thank
hear
you.
you.
Sounds good, and I can hear you guys, so that sounds good. Okay, well, welcome to our MOTS EDI March 2nd, 2022 webinar. For those of you new, or not as familiar with webinars, there's a panel that popped up when you joined, and in that panel, there's a box that gives room for asking questions. The way these webinars are set up is that we present all kinds of stuff with different presenters, and when you have any questions, just type them in there, and my coworkers are monitoring them, and hopefully they can answer them. And if it's an interesting question that everybody might learn from, then we might bring it to the floor. It is recorded for those of you who like to share it with coworkers or might not be able to sit through the whole thing because other things come up or the phone rings and you have a fire to put out. That helps. That happens all the time. So for those of you, we record it, and within usually a couple of days, we have it out on our website, so you can take your time and pick out the pieces that you'd like to watch. So, okay, I see hands and question marks already popping up. So is something, let me do a quick check to see what the question is.
Just letting you know that the participants can hear you as well.
Ah, great. And whose hand is raised? I see a hand raised, but I can't see who it, oh, it's gone now. Okay, maybe that was something. Thanks, Justin. Okay, let's get going. Welcome to our MOTS webinar. Why do we do these webinars? And we do them once a month, every first Wednesday of the month, and we do it from 9 to 10. And we use these to communicate with you guys. We thought it's a nice platform to talk to you, give you information about things that are happening in our world, things that are changing. I know we also send out a letter, but this is usually a more interactive platform, and we can be as up to date as we want. So we like to discuss data issues. They are always very near and dear to my heart, and we'd like to get the best quality data that we can so we can inform everybody with the information that we have. Get your feedback, because it can go back and forth, and if there's any issues that you'd like to discuss, or certain parts of the system, or certain things in the business that you think may be a good idea for us to discuss, then you can tell us, and hopefully we can accommodate and make that an item on our agenda for the next webinar. And again, of course, hopefully we can answer all of your questions. Just a sec. There is a button popping up that I did not want to see. Okay, and then go back, and then we go to the news update. I forgot to introduce my coworkers, Lyle, Justin, Jody, Mary, and a special guest today, and Lyle's going to tell you guys everything about that. Go ahead, Lyle.
Hi. Our first update is that we have a new projected state office opening date of May 1st. So if everything trends as it has been trended, we will be able to be back in the office on May 1st. I know we have some coworkers that are very excited to return. I don't happen to be one of them. I'll still be assisting from home, but it'll be nice to be in the office when we have to meet with stakeholders. And then the next big news is that I will be transitioning to a new position as a MOTS interoperability data analyst, and we'll have a new MOTS system admin, which will be Kayla Camelli. Kayla, do you want to tell everyone a bit about yourself?
Sure, thanks, Lyle. Hello, everybody. My name is Kayla Camelli. I am the new system admin for MOTS and new MOTS. During this transition, I'm new to the state as of last week, so I'm still working out some stuff. But I'm happy to be a part of this team, and I look forward to supporting you all in the future. Thanks, Lyle.
Great. So the next news is that we're still waiting to hear back about the administrative burden. We have a June 1st date, but we have no hard rules about when we are lifting the burden. So for right now, we're just waiting to hear and get more guidance.
Excellent. Thank you, guys. And welcome, Kayla. And good luck with all the acronyms. That'll be a little while before we get through all of those. So. Okay, next on the agenda is Justin, and he would like to talk about anomaly reports. Go ahead, Justin.
Yeah, because that seems to be my hobby lately. So a couple of months ago in this webinar, we mentioned that we have some anomaly reports in MOTS. They're the obvious errors that are reported back to you in your response files, but then we've got some other things that just look weird. They may be right and they may be wrong. We're not sure, and we're asking for clarification. This is stuff like a 9-year-old who's divorced, or someone who's on probation but apparently has never been arrested, things of that nature. Starting in January, we sent these anomaly reports directly to the facility primary contact, and we've had some questions about what to do with them. So I'm going to give you a little information on that. First of all, you can reply directly to the emails that contain the anomaly reports. Those come from our secure server, but they're set to reply to MOTS support. So just click reply in the secure email message, and the message will come back to us securely. As for the data in the reports, if you look through the anomaly report and you see something that we said looks a little off, but it is correct as entered, let us know. You can send us the spreadsheet back with some notes added to it, or just an email message, or whatever other documentation you'd like to send, and then we can apply a filter to remove those records from future anomaly notifications. If you've got a locked field that needs to be changed for an active or inactive client, now a locked field is the date of birth, last name at birth, admission date, and client ID. You can download the data corrections request spreadsheet from our website, fill that out and send it in. We'll make the changes for you. If there are any other fields that need to be changed for an active client, best thing to do is to update the record in your system, however you do that, and submit a status update. If you've got other fields that need to be changed for an inactive client, unfortunately, there's not a whole lot we can do about it, but please update the record in your system anyway, and then notify us in the same way you would as if the data was correct as entered. We'll apply that filter again and hide it from future anomaly notifications. And I've got a couple more details about a few specific anomalies that are coming up on a future slide.
Excellent, thank you, Justin. Okay, and next person on the agenda is Jody, who's going to tell you a little bit more about the non-Medicaid services files. Go ahead, Jody.
All right, thanks, Pete. So, yeah, good morning, everybody. Nice to have all of you here with us. Thank you for taking some time to be here this morning. So the non-Medicaid services file, we kind of wanted to talk a little bit about this because there have been a few things that have kind of come up over the last few months. Some clarifications, a little confusion. We have some new individuals at organizations that have been taking over the MOTS. So I kind of wanted to talk about what we've been seeing. And the first information here is just going to be a little bit about what the non-Medicaid services is. In MOTS, we have you send through EDI the electronic way, which most of you all do that are on the call here. You have your status file, which is the one that sends us admissions and discharges and updates on clients. And then you have the non-Medicaid services file. So what is this thing? Well, it is a monthly MOTS EDI file that sends the services received by clients that are not funded by Medicaid or OHP, but they do utilize public dollars. And this would also include any DUII or medication-assisted treatment, like methadone treatment. Those are sent to us regardless of payer, which would include self-pay and even private insurance. And that's through some administrative rule and some other requirements. So which services do you send? Well, this is going to be all associated procedures that a client receives during the treatment episodes within your organization that fit the description above. The reason we don't ask for you to send the Medicaid or OHP procedures or services that you do is because those we have access to through our MMIS claims system. So there's no need for you to send those twice. We have access to them from there. So the frequency, how often is this file sent? Because it is separate from your status file. Typically, it is sent every 30 days. An example would be like for February, this past month, that period of time, a file would be sent by the 15th of March. And there also are some reports that come out around the middle of the month that go to the primary facility contact, I believe, which do speak to your non-Medicaid services and how many have been received by us by the date you sent them, and then also by the date of the actual service. So how does this kind of process work for these type of files? The file is going to be submitted to MOTS for processing, just like you do the status, which most of you are probably familiar with. And then a results file will be available from MOTS stating what errors on services that could not be accepted by MOTS and how many services were accepted. So it's very similar if some of you aren't familiar, or if you have automation from where your system sends and retrieves these files automatically for you and puts them into your system. But these are similar to the results file you get for status. So it tells you kind of what's up and what's good and what's not. So Pete, if you could advance to the next slide, we'll talk about what's kind of come up here recently. So when working with some of the new providers, new projects, just different inquiries, there's been a little bit of confusion on, well, do we have to correct those errors? Do we have to resend them? A lot of individuals have been under the impression that you just send that thing once a month and then that's it. And you don't really have to do much with it beyond that. So you do need to look at the services file the same as you would the status file, the results when you get them back, because there are some errors that come back, and when these errors come back, those services were not accepted by MOTS, and we don't have them for your clients. So with the service file, there's really only a couple common errors. You might get a duplicate diagnosis code is not accepted, or maybe we don't have a procedure code or a modifier in that's new. You might get something like that. And those, of course, would also need to be resubmitted. But the most common that we see are these that are listed here, the two. The first one would say the client does not exist. When you get an error like that on your service file, what that means is MOTS has not received an initial status report on the client, and this is required before services can be accepted. The reason that this is a requirement is because the service file is a subset of information on the client and their service that aligns with the status report that you sent to us. So it's important that we receive that first. We only have to receive it once for the services to align with that and tie those to the client if they're accepted. So if you get those, kind of what you need to do is you're going to need to make sure that you get the client sent into a status file to MOTS that's accepted. And then at that point, you can resubmit these services and they should be accepted. The second one is going to be last name at birth or date of birth that are not the same. There's a grammatical error there, but the last name of birth or date of birth are not the same. What this means is that that subset of information that comes on the service file has the client ID, of course, but it also has the last name at birth and the date of birth, and those two elements align with your status report. So if for some reason the last name at birth or the date of birth has changed somehow, you're going to get this error. So the fields in MOTS basically are not matching what is being submitted from your EHR. This does happen on last name at birth, oftentimes when an individual comes in for treatment and maybe they don't, for some reason you aren't able to get their actual last name at birth. Maybe their, state at that moment is just not conducive to getting all the information. So later on you update your EHR system, and then when you send it to us, the updated real last name at birth comes and MOTS says, hey, we have this one. And as Justin mentioned, the last name at birth and date of birth are locked fields, okay, which means they need to be changed by us if MOTS needs to be updated on our side. So when you get these errors, you just kind of determine which one is correct. Is MOTS correct, the information that we have, or is your EHR correct? If MOTS is correct, then you would update your EHR to match. Because sometimes we've seen where somebody might come in for a crisis and they're in treatment, and maybe the staff that enter the crisis just put in the same last name at birth as their last name, and then it, makes things out of alignment. That's how that happens sometimes. So if your EHR is the one that is correct, then you would need to fill out a MOTS data correction request. As Justin was mentioning, similar with the Anomalies reports and information to send us, you fill out this correction and you put the updated information, and then you send it to MOTS support. And MOTS support will look over those. They will make the changes, and they will let you know once those changes have been done. And if there is any issue with any of them, they do explain that. And so that between the two, MOTS support and yourselves, we can get that figured out. Once these errors have been, once these corrections have been done, either you submit your initial status on the first error, so the client's there, or the other ones are changed, then you're going to want to resubmit the errored services, and the resubmission of those is required once these issues have been resolved. So it is a process, and depending on which EHR you have and you're utilizing, the process for resubmission may vary. So if you are unsure of the resubmission process or what's the best course of action to do that, please maybe reach out to myself, and if need be, we can get your vendor, your support EHR vendor involved, and we can figure out what is the best way to do that based on the flow of their system. But these are important as we, go into different contracting periods, and we are looking at measures and outcomes and things of that nature, especially with the pandemic and all of the, special different ways of doing services, telehealth, all of that. We want to make sure that we have all these services so that our teams can kind of see what happened during that episode, and maybe what the outcomes were, and maybe what we need to modify or change. So I know this is a lot of information on these two slides, but just the basic thing is there are errors on service files typically of some sort, and you need to get them corrected and resubmitted. So with this overview that we did here, it obviously may raise some questions, need some additional information, unsure. As always, reach out to myself, and we can schedule a time to chat and to make sure that we understand that, and we figure out the best course of action for you. One last thing is, if for some reason your organization has either not been sending non-Medicaid services, or maybe, and you need to, or you haven't been correcting any of the errors, the nice thing is with the non-Medicaid service file is that as long as the last name at birth and date of birth and client ID match, we can go backwards in time if your EHR will capture those again and send them. So we don't have as much of the sequential requirements for things that are being sent in your file as a status file. So it's a little easier to get these caught up or resubmitted. So with that, I'm pretty much done, so I'm going to pause, see if there are any questions in the chat box from my teammates here.
Yes, we do have a question, Jody. The question is,
Sure.
if we are already sending the DUI or medication assisted through the regular MOTS, do they also have to be reported on the non-Medicaid report?
Yes. So the difference is the status report that is sent to us basically gives us the demographics, the different behavioral health values and details. It also gives us any addiction details on the client, especially for Dewey and methadone. They're going to have addiction information. So status is really telling us kind of where the client's at as far as, you know, what are their addictions, what are their frequency of addictions. Their behavioral health details would include diagnoses, referred from fields, different areas of improvement, sources of payment, and then, of course, the client profile details in the status file are going to give us their name, date of birth, client ID, Medicaid ID, race, ethnicity, treatment status, things of that nature. So the status file is just kind of giving us a snapshot of where that client's at the moment. The services file differs as it's kind of like a billing. Like if you were submitting a billing to an insurance company or to OHP Medicaid, if you were sending an 837 file, it's an electronic file where you submit that file, you tell the insurer what you did, and then they reimburse you for payment based on things being correct in alignment. Our services file is basically like a billing file that comes to us. It's all the individual services. So like maybe the client had, 15 group sessions, they had individual sessions, they had UAs with methadone. Of course, there's the disbursement of that. So it's all those individual things. The service file will include for each of those services the procedure code, the diagnosis code associated with it, as well as any modifiers. So yeah, it is definitely very different from the status file, and we do need both of them sent.
Thanks, Jody. We also have a comment that I think should be shared with the group. It says, don't know if you track errors that weren't resolved. We don't, by the way, but especially with non-Medicaid, realization that the record shouldn't have been submitted at all often comes with researching the rejection. Those files would not get submitted. And I think that's relevant. It is a good idea to really check those rejected files. Maybe they shouldn't have been submitted in the first place.
Yes, and also with that, yeah, definitely it may not have been needed to be submitted in the first place. Something that went along with that, and it's escaping me. And one thing is too, when you get those results files, maybe you see something that shouldn't have been submitted. Depending on your EHR system and the way that their logic and creation of your service file is done, you may need to have a conversation with them. A lot of them have different ways of filtering out certain services that shouldn't go. It's usually tied somewhere. The non-Medicaid service file is tied somewhere into the billing side of your system. So there could be many reasons why maybe some are coming that shouldn't. So if you see some that shouldn't, then definitely we should have a conversation and maybe check with your particular EHR to see what is the process to align that more appropriately.
Excellent. Thank you, guys. Did that answer all the questions, Justin?
I believe so.
Great. And anything you want to add, Jody, or I thought that was nice and clear.
Yep. No, the only thing to add is just by all means reach out to us if you're unsure or or whatnot, reach out. We can have a conversation quickly and just determine maybe everything's good, maybe we need to make some changes. But as most of you know, we got a great support team here, so we're here to help. So just let us know what you need.
Excellent. Thank you, guys. Okay, well, you guys just heard from Justin, so you're going to hear from him a little more.
Thanks, Pete. I mentioned the anomaly reports a bit ago, and 2 of those concern the organ driver's license and SID number fields. We have discovered a bit of a problem in the system in that those fields cannot be cleared. So maybe you've entered, let's say, a SID number placeholder of all 9s, and then realize that's no longer required, and we really shouldn't have that placeholder in the first place. And you submit a status update where that's null or blank. Well, it appears to work, but the previous entry comes right back. We're investigating that as a bug, no ETA on a resolution just yet. So for now, if you need to remove one of those numbers because it doesn't apply to the client or it's a placeholder that shouldn't have been submitted in the first place, send us a message. We'll keep track of the changes. If possible, we'll apply them as a database fix when the problem is resolved. And if they are showing up on your anomaly reports, we'll hide them. Just remember that the SID number is optional. The organ driver's license is required for DUII clients. And regarding the anomaly reports covering these, I discovered just 2 days ago that there was a minor problem in my data source that I report from, not in the MOTS database, that was pulling some false positives. So the next anomaly reports on the SID number and ODL placeholders should be quite a bit smaller.
Excellent, thank you. Just to, for the record, the clearing isn't working. If you put a placeholder and you find out the correct driver's license number and you make that update, that comes through, right?
That is correct. A change will come through, but not a clear.
Excellent, excellent. So it's just if you want to clear the field, that's the main thing. So, but fixing it with an update for the right number, that works great. So excellent. I just wanted to have that clear. Okay, well, thank you, Justin. And then we are handing off the microphone to Lyle, because he's going to talk a little bit about something that happens off and on, and that's the agency name change. Go ahead, Lyle.
Hi, I just wanted to let everyone know that recently MOTS has experienced a number of providers who haven't updated their names. I know it seems to be a good year to rebrand or to change your name, and we just want to make sure that we always have the most accurate data for your facility. So if there is any change to your facility name, please contact MOTS support so that we can update it. If your name is out of alignment, you might come up on a non-compliant report, or we might find that you're not submitting your data, and that won't be true. It's just that we have inaccurate information for you. So if you could just, check, make sure that we have the most accurate agency name information for you, or any information for address or anything like that. That way we can best support you, because when we have the most information and the most accurate information about our providers, we can better support them.
Excellent. Thanks, Lyle.
Can I add one thing to that, Pete?
Sure.
So we have had some notifications from our program staff of when an organization, like as Lyle mentioned, you might be rebranding, but you also might be either changing ownership, you may be buying out a partner, you may be a new company that has bought out the organization. And when those things happen, definitely let us know as well. I mean, obviously the name change is, we need to get corrected, but we also might need to have some conversations on how you expect to continue reporting, how your organization is set up now in the new format, or with the new ownership. So please let us know if you're changing ownership, and so we can make sure that all of our people are able to help and assist and make sure that the transition, if there is one for the MOTS reporting, is as smooth and streamlined as possible. This just came in the last few days, so that's why I wanted to mention it here. Thanks.
Excellent. Thank you, Jody. Okay, so let's go back to the agenda. And on the agenda, excuse me, is Compass News. As you all might know, that MOTS is a part of the Compass team. And Compass is more than just MOTS. There's been association for a while. First, it was the same thing because that was the only system we had. But over the last couple of years, we've been expanding and new systems are coming and new things are changing. So we thought we bring in a little agenda item to talk a little bit about Compass News because it's all behavioral health related, and you might hear information within your organization, or you might have questions. So we thought we use this platform, our monthly webinar, to talk about it, and maybe over time expand it to discuss different issues even more. So one of the things that I'd like to talk about is some of the new systems that have been added to the Compass suite, basically, because we have MOTS, which is a huge system. But recently we have also added ACR, and ACR is the acute care reporting that is up and running, and we are working on a 2.0 version. And the 2.0 version will be placed on the same platform as we have for PGNet. PGNet stands for Problem Gambling, and it's programmed on the .NET. The MOD system is, for those of you interested, is programmed on Cold Fusion, but we are lacking support for that. There are hardly any programmers anymore. It's considered an old language, so we have to come up with some new stuff. So we, as an organization, moved to .NET. So we created a problem gambling system that is up and running and that is getting traction, along with the ACR2 and CLICS. CLICS, I have not memorized the acronym yet, but it is replacing the old licensing and certification system. That is also one that we're working on. That's not ready yet. We are helping our team within Oregon Health Authority to make sure that all the licenses and certificates are up and running, and we're helping them to make sure that we can print out the right one, make the system stable, the current system, because that's built on an old Microsoft Access setup, so that's a little clunky, and we're working hard to get that going. So another thing you might have heard about is the BHDW, or Behavioral Health Data Warehouse. And that is a big thing that we've been wanting for, at least I have, for a very, very long time. What it is combining all the different systems that we have within the behavioral health part of the Oregon Health Authority, and which also means that we will be combining the data of the Medicaid and MOTS in one place, in one system, in one warehouse. The thing we did, we hired a contractor, and we are currently swamped with meetings to do discovery sessions, and hopefully by the end of this year, there is a behavioral health data warehouse. And the great thing about it is that we can have all the information that you guys use and that we like to share with our legislator, with our federal government, with management within our organization, to learn a lot more if we can, because that was always a bit of the clunky part within the systems. MOTS and MMIS kind of talk to each other, but it's basically Medicaid and non-Medicaid. So, but combined, they are the full picture of what's happening in the behavioral health world in Oregon. So it'd be great to get all that information in there. And also gambling will go in there, and ACR, CLICS eventually. The one system for individuals is also going to be, might be part of it. So it's something that we are really excited about, and hopefully the basics we can get by the end of the year, and then over time more systems are created and they might be added to the system. And then another thing in the Compass News is the MOTS replacement. That is something that a lot of people have been talking about, because a lot of people complain about the system, but there is no perfect system, I'm afraid, because if there is a system, there's always something that it can do or shouldn't do or wanted to do different. So it is a plan, but no dates or any schedule has been set up yet. So if you hear anything about there's a new MOTS coming, so don't worry about the data, that is not true. Always keep submitting your data, because the data that you submit, we need to submit to the federal government to get substantial grants. And if we don't get those grants, we can't hire you guys to do the behavioral health treatment. So, and some of you don't need the state that much, but the majority uses a lot of the state money. So, and our state money comes from the federal government. So we definitely need the data. And when things change to a different system, and if there's changes that will be coming up, we'll definitely let you know. Did that raise any questions that I missed?
It did. We have one. Will we be able to request reports from that data? And I'm assuming that means the behavioral health data warehouse. I believe the answer for service providers is yes, but I didn't want to say for sure.
You're absolutely right, Justin. Yes, that's also one of the nice things, because certain information is difficult for you guys to sort out of your the myriad of information of data that's out there. But we hope to have it in one nice, well-organized place, one nice big warehouse. And you might be talking to Justin a lot if you are talking to data, or me. I think that's going to be a small part of our future, is to provide everybody with information from that data warehouse. Anything else?
That's the only question I saw.
Go ahead.
Cool.
Go ahead, Justin. Oh, okay. Can I just add one thing, Pete?
Sure.
Okay. So just because most of you that are on here are, reporting to MOTS, and just to let you know, for the MOTS replacement project, Kayla Camilli, our new MOTS system administrator, and myself are going to be the lead people that will be working from start to finish on the new MOTS system. So we will be working closely with our client entry providers as well as the EDI providers. I understand a lot of how the different systems work, how the different data is collected. So we will be looking for some beta users as time progresses. But just to reassure everybody here that, we, the two of us, will be involved. Of course, Pete and Lyle and the rest of the team will be backing us up in this process. But just to reassure everyone that we're going to work really hard to keep you involved, updated, well-informed in advance, proactive. So I just kind of wanted to add that in. So I'm excited. We have Kayla Camilli with us. And also the other thing, too, with the data warehouse that is, I think, super awesome, so I'm just going to give a little shout out, is that is what Lyle, as he moved into his new role, will be leading up that effort along with Pete. And so all of you that have worked with Lyle and then, of course, worked with Pete for many years, those are our main lead folks on these projects. So I'm very excited. I know this project is going to be a success, and just to let all of you know, because many of you work with us, and just kind of how our internal individuals are lining up with these new projects. So with that, Pete, I will turn it back to you. I think I'm next anyways, but I just wanted to throw that out there for everybody.
Thank you, Jody. Yeah, that's good information. Yes. Lyle is the product owner, as we call it. It's one of those nice terms, of the behavioral health data warehouse. And that will takes me back to the agenda. And guess who's next on the agenda? Jody, switching systems, the never-ending story.
The never-ending story. I mean, actually, even with with the pandemic that we've experienced, and possibly ending into the endemic stage, we still have providers changing systems, and we do have providers that are selecting systems who are kind of developing their MOTS from the ground up. So we have a lot of things going on right now with changing systems and new systems coming on board to the MOTS EDI reporting. So for any of you, just if you're thinking of changing, let us know. we don't care if it's 30 days from now or a year from now or whatnot. It just helps us to kind of keep a pulse on what's going on, where to shift resources, and to put some notes on our calendars to follow up with you. So, going to be changing, or possibly let us know. The second thing is, if you're looking at an electronic health record system, or maybe you're looking at a new platform for your existing system, the MOTS functionality piece seems to be very important to most providers when they talk with us, of how that works, and knowing how that data is going to get to us electronically. So what really helps, I think, when you're looking at different systems, and this is just feedback we've received, is when you're looking at different systems, maybe ask what the actual process is for this functionality. How does it work with the EHR from the client entrance into your EHR system to the MOTS actually being submitted? How do those files that we talked about earlier get to us? What happens with the results files? Knowing these things are going to help you determine how much staff time is going to be required and who will do which steps. Because there's often a little bit of a thought that, we're going to go EDI, and maybe not you that are on the call, but maybe others within your organization that just think, well, it's going to be all automatic. It's going to be, we won't ever have to worry about it. And that might be true, but oftentimes, more often than not, there's still some staff involvement that needs to happen. So we do want to call out that there is no one way that is better than another to get your MOTS EDI data to us. We have a file format specification, and we have the data dictionary, which tells you what you need to send us and how. So as long as we get it in our format, we don't care how that works internally with the different EHRs. Just know that there's just differences in workflows, and one workflow might be better for your organization or not, but that we have no preference. But I just want to let folks know this, because we see a lot of changes going on, and I think sometimes this helps the EHR company as well as yourselves to really understand that MOTS piece. So with the next piece, sorry, number 3, the project timing, of course, ties with number 1, and letting us know there is a process for changing data submissions. So if you're currently submitting through EDI and you're just going to another EHR, or you're upgrading to the newest platform for your existing, there is a process for still changing from one EHR to another. If you're submitting through the manual through our web portal, the client entry portal, there is a process to move you from that to electronic. So we'll go over that. The number 5 is your secure file transfer protocol setup. Sounds like a big jumbled up bunch of words, but you may hear it as SFTP. This is really just a directory on one of our servers that either your EHR or a program you use connects to us here at MOTS, and you drop off your files, or your system does, and you pick up the results in the morning. So we do need to set that up. If you're currently client entry, you probably don't have this set up. So the sooner we know you're thinking of changing, the sooner we can get this piece in process, because this piece lately, with just the inundated volume of requests coming in and different things, it's taking longer than it had been in the past. So, and this is, again, just if you are EDI at the moment and you're going to go to another system, you're going to continue to utilize the same SFTP setup that you currently have. So there wouldn't be much of a change for you if you're already EDI. The next thing is client ID considerations. Once you let us know you're thinking of changing and have made a decision, then we can talk about whether we need to address changing client IDs on the MOTS side, or how we're going to set up that new incoming stream of data. We're going to test the files through EDI. So if you maybe you pick an EHR and they've been submitting to MOTS for, since the beginning, they have many, many providers. You still at your organization will need to certify the files for you. And the reason we do that is there is so much customization and ways to put the different data elements in different places for workflows. We just want to make sure that all the mapping, all the values, that everything that is set up for your customized environment is aligning with what we're expecting to see on the MOC side. So just be aware. It'll be fairly painless, but you will need to still test the files through EDI. If you have selected an EHR that has not developed a MOC EDI transmission or file yet for their product, then we definitely will do a little bit more additional, maybe, conversations, meetings, and testing because as they're developing and getting that set up, we'll want to make sure that we can help out and provide feedback and input as needed. You're going to go live once we're all tested, and then number 9 is a follow-up period, and that is really determined by you, your organization, your vendor, and what that is that once you're live, sometimes if you're new to EDI or you have a new system, you might, we might want to meet weekly, bi-weekly, monthly, whatever the cadences that you prefer, but it just helps us to see how is the live data coming in. Do you have any questions? Is there any errors that you hadn't seen before? So we do that as long as you need that. And we've been doing this for 8 years now. So we kind of know what works and what doesn't work. So biggest thing, if you take nothing, or I didn't say nothing, but the biggest thing to take away from this is number 1 is letting us know. That way we can kind of gear up and think of the things that we might need to help you out with right away. So with that, I will turn it back to you, Pete, unless we have any questions regarding this.
I didn't see anything pop up, and I forgot to check, so I don't think there is anything. I see a question, but I think those were all answered. So thank you, Jody. Yeah, it's always very important to communication is always very important. So, okay, then we get to the, yes, go ahead.
I see one question about the data warehouse from Bob Hutchison. He's asking, what software are you using to build it?
It's all going to be in Azure ADOS, and it's probably going to be the Power BI will be the main tool for us to create databases and stuff like that, to creating the reports and the connections. So we still have quite a learning curve. There's a lot of new tools that will be involved. Yeah. But it's the contractor that will be building it, and then we'll transfer the information and train us, and then we can tell you a lot more about what's going on. So it's all still very new and exciting. I hope that answered the questions a little bit. Okay, Q&A. If you have any questions that you forgot to ask, and you always realize that a little bit later, there's always mods.support at dhsoha.state.or.us. It's always permanently monitored by 1 or 2 or 3 people, and your questions will be asked pretty soon. So as I mentioned in the beginning, the webinar will be recorded and will be posted in a day or 2 or 3 sometimes. Also on that site, there are the future mods webinars, and if you might forget, you might have a recurring thing from once a month, every first Wednesday of the month. There's once in a rare while we've had an exception because of a holiday or something, but a quick peek at my calendar, I don't think there's any first Wednesday. That's because we had it with the 4th of July was on a Wednesday or something. So we kind of skipped a week here or there, but I don't see anything. So the next currently with the focus a little bit more on the client entry part is going to be Wednesday, April 6th. And as you can see, the bottom of our website, at the bottom, there's the link to our website. And within a few months, we'll probably remove the Lyle Ming and we'll have Kayla on there as soon as she is all set up. Because as you might all know, it takes a little while for people to get everything up and running within an organization. So, okay, did I miss any questions? and it's very nice and quiet. Good, cool. Well, thank you all very much and have a wonderful rest of your day. Take care. Bye-bye.